The Gauteng Department of Health will have to update and maintain the backlog list of cancer patients awaiting radiation oncology services in the province and take all necessary steps to provide treatment to those patients, whether at public or private facilities. This is in spite of the GDoH, the department turning to the Supreme Court of Appeal to appeal a judgment that was issued earlier on in the year, in terms of which it was ordered to come to the aid of these patients. While the pending appeal would ordinarily have suspended operation of the order, the Cancer Alliance, supported by Section 27, turned to the Gauteng Local Division of the High Court in Johannesburg to ask that the order remain in force pending the outcome of the appeal. So let's take that conversation forward. I'm joined by the Director of Cancer Alliance, Salome Mayor. Good afternoon and thank you for your time. So just locate us in terms of this long-dragging dispute between yourselves and other organizations around the provision of radiation oncology services at public facilities in Gauteng. Where does this latest decision leave us?
The very latest decision confirms that the Gauteng Health Department is responsible to maintain the backlog list, which is a backlog list of nearly 3,000 patients that we, in fact, handed to the department in already 2022. Now, the department disputes that they ever received such a backlog list. That is despite the fact that they internally also distributed the backlog list. What we are saying is we want to know each of those patients who at that time in 2022, some of those patients had already been waiting for more than 4 years for their treatment. We want to know, where are those people? We cannot just write people off and glibly then just believe what Gauteng is telling us by saying we've cleared the backlog list. We know of patients that have not been recalled and that are still awaiting their radiation treatment. And that is, in essence, what this court order is about, to say that you've got to go back and compare apples with apples, meaning go back to the original list and then go and determine which of those patients are still alive, which of those patients will still require any further treatment, which of those patients, unfortunately, will never benefit from any further treatment or unfortunately have passed away.
So if I understand you correctly, whatever contentions about how the backlog has been dealt with being made by the Gauteng Department of Health, you want them to be understood against the original backlog list from 2022. And are you saying that for as long as that is not happening, the contentions of the backlog having been dealt with, having had marathons where, they were targeting and trying to get people into treatment, any of those claims being made should not be believed?
Quite correct, because we're talking about 3,000 patients and we want to know where are they. That is important, that we actually say we cannot just forget about people. Where are these people in the system? And that is, in essence, what we want to know, because ultimately the decision was the original judgment was unlawful and unconstitutional. So if we still have patients within the system that have not been dealt with, then we need to be able to go back and actually say, how are we going to manage these patients?
What is the point, as far as you understand it, that the Gauteng Department of Health is quibbling with from the earlier judgment that placed responsibility on them and wanted them to come up with a plan on how to deal with the backlog? What is the point they're taking on appeal? And why do you believe that they shouldn't benefit from the settled principle that says if an order is being taken on appeal, the default position is that the operation of that order is suspended pending that appeal process? Why should that not be the path that is followed in this case?
We want to stress that it is important that we have that updated backlog list, because without that, we will not know what happened to 3,000 people. What we do know is that the Gauteng Health Department, and that is what they're claiming, and we know that that is happening, that they are busy with the outsourcing of radiation oncology treatment for patients on the ordinary waiting list. And then, yes, there are some patients that are on the backlog list that have been treated. Gauteng, when they started with the court case, actually disputed the fact that there was a backlog list. And seemingly, they are still saying there was never a backlog list that was supplied to them. So those are the kind of contentious issues that we need to actually get out of the way. But it comes back to the fact that people have a constitutional right, which is a right to healthcare.
Yeah.
This case was not about whether there was money, because the money was indeed allocated. And the Gauteng Health Department, even when they allocated the money, couldn't even initiate the outsourcing. So this case is very particularly about whether patients' health rights have been attended to.
Yeah. And in fact, while you talk about the money, the judge in the other matter, Judge van Nieuwenhuizen, and I quote here saying, the provincial health respondents have done nothing meaningful since the money was allocated in March 2023 to actually provide radiation oncology treatment to the cancer patients. What's at the heart of this? Why is this even an issue of debate that, you know, if there's a backlog of cancer patients, they should be attended to, especially in a context, as you say, where there had been money that had been allocated? What's at the heart of the difficulties?
At the very heart of this is the actual, and I can only call it a mess up, at Charlotte Maxeke Hospital. In 2017, the Human Rights Commission already was alerted about the crisis of radiation oncology at Charlotte Maxeke Hospital. At that point already, there was highlighted in terms of the lack of equipment as well as the lack of staff. In 2021, November 2021, we marched to the Provincial Health Department and we handed over a memorandum in which we highlighted exactly the problem at Charlotte Maxeke and indicating there is not enough equipment and there is not enough staff. Now, subsequent to that, we're talking about 2021. Subsequent to that, not one single Linux machine, that's a Linux accelerator that is used for radiation equipment, has entered Charlotte Maxeke Hospital, meaning in terms of equipment. The tender has been advertised and apparently the tender has been allocated, but it has not been installed. We're talking 4 years later. What we also know is that the same staff shortage is still relevant. And that is basically because of the occupational services dispensation for radiation planners and treatment providers. That is at the essence of this. We also know that exactly the same CEO of Charlotte Maxeke has been in that position since 2013, and it's now 2025. The same problems has been there for many years, and we have no movement. Gauteng mustn't come and tell us, oh, but we bought equipment. The equipment that was bought is currently in storage. Whilst the bunkers are being built, the same CEO declined the offer to actually have equipment in her hospital. So we're talking about management as well as the whole aspect of integrated planning, dealing with it. And then we're talking about how do you communicate with your patient to ensure that your patient is treated with the utmost respect and with dignity that he do require. Don't just ignore them.
Yeah. So with the operation of the order that was issued earlier on by the court now not being suspended, and instead the department being told that you have a responsibility to take whatever measures are necessary, are we clearer as to what those measures look like, immediate steps that need to be taken to deal with the situation, even as the department's appeal against the judgment of Judge van Nieuwenhuizen is outstanding?
It is clear that they must go back to the drawing board and update the waiting list, even if they have to appoint outside consultants, because we also need to understand that to update that backlog list, they need radiation specialists to actually update that backlog list, as well as administrative staff. So whatever it takes you financially to actually update that backlog list, you were supposed to actually finalize that already in June. You haven't done that. Now you've got a second court order that is telling you you have to do it, so that we can start determining what is it that we are dealing with. Stop telling us that you are providing treatment. We know that you are providing treatment in your outsourcing arrangements. But that is mostly, I want to say, current patients that are being treated. Let us go and find those patients that have not been treated, and let us start looking at them and whether they will still require treatment. That is the constitutional right of each of those patients.
Yeah. Lastly, it's a bit of a difficult question, and I suppose a grim one as well in many ways. Do we know anything about the plight of the people, the cancer patients who were on that waiting list since 2022? The list that you provided, the list at the heart of much contention in all of this litigation. Do we know what the cost has been to them of this delay?
What we do know, for instance, is we have Tatu Mansho, who has been one of our patients right from the word go. Tatu was identified 4 years ago already as requiring urgent radiation treatment. Tatu's cancer has metastasized to her lungs as well as to her brain, and she is currently on oxygen. She will never, ever benefit from any further treatment further. We also know of other patients, and specifically our prostate cancer patients, because that was in fact the longest list, but the list that had most of the patients. We also know that, and we do have some of those patients' names, we also do know of patients that unfortunately have passed away because they were just never heard anything again from the department. So you cannot emphatically say they died because they were on the waiting list. However, the chances are that the fact that they didn't receive their radiation treatment in time actually was the cause of their death.
And
ultimately.
This is info that you have because you were integral in the compilation of the original list. I'm asking, this is information that you have at hand, such that if the department starts making moves in compliance with the latest judgment and says, okay, let's update what this list looks like, you would be at hand to provide the information to the best of your ability as an organization.
To the best of our ability, we will provide what we have, but we also can use this platform to say to any of the patients that would have accessed Charlotte Maxeke Hospital, if you were to have received treatment by the Department of Gauteng Health Department at Charlotte Maxeke in the period between, and I want to even say 2021 to now, and you haven't heard a single word from them, please make contact with us directly, because this is the kind of thing where we need to actually have our people coming forward and say, I have a right to health.
Sure. All right, let's leave it there. Thank you for your time this afternoon. That's Salome Mayor, who is the director of the Cancer Alliance. It does feel like this is a conversation where we should be hearing as well from the Department of Health. So we'll be extending again an invitation to the department and see if they will come through and talk to us, not just broadly, but in the context and framework of the latest decision that has come through from the courts.